Hi, and welcome to VIP Ask the Candidates, a set of short videos where we ask the four main party candidates up for election to be Bristol's next mayor the questions that are important to the communities we work with. In this video, we ask them what they would do for disabled people in Bristol and get answers and hear their views on topics including making upcoming developments in the city accessible, the mental health crisis affecting young people, and the need for accessible communications. We worked with our partner WECIL to set the questions we ask in this video. Coming up, you will hear from the Conservative Party candidate, Alistair Watson, Green Party candidate, Sandy Horuben, Labour Party candidate, Marvin Rees, Liberal Democrat candidate, Caroline Gooch. Each candidate was interviewed separately, so their answers are a direct response to the questions, and they didn't get to hear what each other had to say in advance. We haven't edited their responses, so you can hear what they had to say in full. The Voice and Influence Partnership was set up to help make sure that individuals, groups and communities whose voices aren't always heard or listened to are part of shaping Bristol's future. The Care Forum, who I work for, leads the project and also delivers its work supporting Bristol's Black and minority ethnic communities. The partnership also includes the Amadan Centre, who lead our multi-faith work, WECIL, who are our lead for disability, OTR, who lead our LGBTQ+ work, and Bristol Older People's Forum, who lead our work for older people. We also have our advisory partners, Centre for the Deaf and Hard of Hearing People, SARI, Stand Against Racism and Inequality, and VOSCA. The Voice and Influence Partnership's work is funded through Bristol City Council's Bristol Impact Fund, but we are fully independent of the council. And now on to the important part, hearing from the candidates. If you're elected to be Mayor of Bristol, what will you do for disabled people in Bristol?
First off, if I can challenge the structure of the question, the premise of the question, I don't like to talk about doing things for people. I much prefer doing them with people. And there's a couple of kind of really important reasons for that. One is I don't claim to come along as a savior. This is about dignity and about leadership. So it's really important that disabled people are given the space to lead and shape the institutions that shape our world. And that's really important. That's a genuine relationship of equals. Secondly, it has been a real lament of mine that politics can sometimes seem like it's transactional. I'll do these three things for you, and with those three things, I'll purchase your vote. I think we've got to get beyond that. It's about seeing how close we can come in a shared understanding of the world, analysis, what we're going to emphasize, and then what we're willing to work on together. And that's a maturing of our politics. So I'll say with, but having said that, we will continue with schemes like Stepping Up, which was started around BME people, but now runs with women and disabled people, and that's about supporting people to actually progress through their organisations. It's been phenomenally successful, been taken on by other cities now, coming down to ask us how we do it. We also aiming to really build inclusion into the physical regeneration of our city. So when we look at Temple Meads, for example, how do we make sure that as we go through the regeneration of Temple Meads, that becomes more accessible for people so they can move around? And again, we've had support from dementia-friendly organisations as well, giving us advice on that. And certainly, again, we think about what we've done with our taxi fleet as well, making sure Hackney carriages are disabled friendly. Economic inclusion, absolutely critical. Physical inclusion in the city, essential for us as well.
What I would do is what they would want me to do. I'd certainly want to know what the priority areas are, whether that's problems with travel, getting in and out of public buildings, whatever, there's a lot of issues out there, and I know that people with disabilities do have issues, and they shouldn't have. We should be able to have a society in which, if you've got a disability, you still have access to what you need and what you want. And there's lots and lots of different types of disabilities. So I can't list out all the things we might do, but I'd certainly want to connect with these groups and see if there's things that we could do within the city to improve the quality of life for everybody who has some sort of disability.
I think the first thing is we need to sort out the pavements and actually make it so that you can get, a wheelchair or a walker or something along the pavements. There are a lot of there's a lot of pavement clutter, a lot of very narrow pavements, tree roots taking up pavements, that all make it very, very difficult if you're unsteady on your feet or in a wheelchair. We definitely need places where there are, someone mentioned to me on Twitter today, the Trenchard Street car park lift. Apparently you used to be able to use that to get up the hill. So because it is quite a climb from the centre up to the BRI, and it would be it's a really good idea to use that, and apparently it was used in the 90s. So things like that, where we can actually flatten out some of the hills for people, and make it, because not everyone who's disabled is in a wheelchair. There are hidden disabilities, or people just who are getting old or have illness, who struggle, and we want to make it possible for more people to walk and cycle. But in that case, you have to take away some of the difficulties that exist for people doing that, and our hills are quite a difficulty for people. So where we could put in lifts to raise people between levels of the city, then that would be great. And there is one at Trenchard Street car park. There's another one on the Portway, the old railway, Clifton Rocks Railway. That would be another one where we could, you could actually have a lift to take people from one level of the city to another. I would like to bring in e-bikes, because while we want to get a lot of people cycling, a lot of people can't cycle, can't manage the hills. So e-bikes would open up the cycling option for a load of people. So if we had like the bikes in London, docked bikes, but they were e-bikes, that would open up for a whole load of people the ability to be able to whiz around the city on a bike, and not have to worry about having to pedal. Then I think the parking, disabled parking, we need to make sure that we plan into every area that we pedestrianise. We need to make sure that we plan in how are people in wheelchairs or limited disability able to get into that zone. So I think you have to be able to say, go to somewhere where you can park your car and then get a mobility scooter, and then everything then needs to be flat and reachable from that. So I just think we need to be very, very careful about planning, and make sure that disability is not an afterthought in planning, that you don't do it and then go, oh, how are disabled people going to get in? You need to start with, how are the least able people going to access this, and build from there up, because you're not going to make more able people not able to get into it. So you have to start with the lowest common denominator. And then there's things like sight loss and things like that. And certainly it really annoys me that the cycle lanes in Bristol city centre are exactly the same colour as the pavement. So how is someone with poor sight going to notice whether they're walking in the cycle lane or the lane for pedestrians if they all look exactly the same? They all look the same to me, and I've got a fur-poke sight. So how are people supposed to know? So it's things like that are just simple stuff. And cobbles as well. Cobbles are really, oh, sorry about the cat. So cobbles are really difficult if you've got mobility issues. I mean, they're difficult if you're wearing high heels, for goodness sake. So whoever decided to put cobbles in was clearly an able chap in flat shoes. So I think it's just stopping and thinking in planning, and then just for when you're planning things, and then for other problems, sometimes we maybe need to think outside the box a little bit, but also bringing people in and asking people, like the WECIL group, is this okay? Does this fit the bill? and what do you need, and what are people finding difficult. I think that, yeah, to be fair, I think if I was in a wheelchair, I'd find getting around Bristol quite difficult. It's not the easiest city at all to navigate.
Through my day job as Chief Executive of Creative Youth Network, we've worked with disabled young people from all sorts of different backgrounds across the city, and I've learned a huge amount. I've also reached out and spoken to a number of different disability groups across the city as a candidate. And I think the single clearest thing that I hear is that we want to be listened to and taken into account when, you know, we're designing our city. The thing that comes up again and again is those shared cycle and pedestrian paths in the city centre. Almost every conversation I have points out how bad they are, how badly marked, how you know, tactile. They're not different, they're not accessible, you know, particularly on a wheelchair. You can't see where they are, and you know, if you're visually impaired, for example, then you won't necessarily be able to see where they are. So you know, that for me is a good example of where the disabled community weren't listened to at the beginning, and I think they would have been a very clear view, and we would have come up with a very different design had disabled people been properly involved. Now, that can be true across the board in designing services that are offered to disabled people, in access to work and business. It's really important that we listen to disabled people. So that's the kind of key thing. You know, I've spoken to people as well who've said there are days they can't go out of their house because cars are parked on the pavement and the bins are out on a Tuesday. So Tuesday is no-go day because you can't get your wheelchair, you can't access the dropped curb down your road or whatever. So, you know, those are the sorts of messages that I hear. We need to design our city better so that it is properly accessible to everyone. I'd add another thing in here, particularly about special educational needs and disabilities with young people. This is clearly an area where, unfortunately, this administration has failed. There is a SEND crisis across the country, but Bristol City Council is at the bottom of the table, which is the worst possible place to be. And it means that disabled children and young people are not getting the right support at the right time. Now, I have a particular passion for this, both through my day job, but I also have 2 adopted children, both with special educational needs. I've had to fight for their needs to be met. I have to say, outside of Bristol, not in Bristol, we lived elsewhere as they were growing up. But we end up feeling like we were fighting the system. We had to take the local authority to court a couple of times. Both times we won, and we were lucky. We had the resources, the knowledge of the system, but many people don't. And if SEND young people and children aren't getting the support that they need early on in life, then their chances in later life will be hugely affected. So for me, this is an absolute personal and professional priority, because if we get it right and children are given the right help at the right time, then they are much more likely to thrive and flourish in their lives in the city, and reach their potential, which is really what I want people to be able to do.
How will you combat the increasing mental health crisis affecting young people across the city? And that was asked by the young people from the Listening Partnership.
I don't know if it's a crisis, but there is certainly an increase in mental health issues with young people, whether that's being because, you know, more of them are understanding that that's why they're not feeling good about themselves or about what life chances they have and so on. So I'm not an expert in this area, so I can't just sort of say, you know, I will do this and that as mayor, but I think we do have to address it and look at how we can put some more, perhaps some extra money in particularly as we come out of the COVID and lockdown, where, you know, things haven't been good for a lot of people. So you know, yeah, I will do what is possible and what is asked on that, but I'm not an expert.
So thank you. Again, this is my day job. We have in Creative Youth Network, we have been at the forefront of integrating mental health training and mental health practitioners into our day-to-day work in youth clubs, in our programs, so that young people don't have to reach out to new services and new people. They can get the mental health support that they need within the services they're already accessing. So the first thing we have to do is to talk about it. The more we talk about it, the more people feel happy to share, and the more happy they are to share, the more likely they are to talk about it early on in their difficulties, and therefore are more likely to get the help that they need quickly, and help them to manage their situation. Then we get into prevention and early intervention, and that's another key thing. The CAMHS waiting lists are so long and the thresholds are so high that young people can sort of be on the waiting list for 18 months or even more, which, clearly 18 months of languishing with mental health difficulties is something that is only going to make it worse. So that prevention and early intervention is really key. And that means embedding mental health services, as I've just described in my own organisation, across the board. So that's in schools, that's in youth groups, it's in medical services, so that young people and people like Listening Partnership, Freedom Youth, and sorry, not Freedom Youth, Off the Record, they run Freedom Youth, so Off the Record and others, so that young people feel able to access that help quickly. And we know, and the evidence from my own organisation is there, that where young people talk about it early on, it often doesn't escalate. It can stay as low-level anxiety or depression. They learn to manage it and come through it really very relatively quickly. However, if you leave it to languish, it will just get worse and worse and worse. So talking about it in order to make people feel comfortable sharing, but then making sure those preventative and early intervention services are there when young people need them.
So we want to set up a good neighbour network for people at risk. We recognise that green space is vital for our mental health, which is something that has become really obvious during the pandemic. And we definitely want to protect green spaces and plant more. So things like pocket parks, everywhere where we're doing pavement widening, where at the moment we've got all the plastic cones, we'd rather have planters, trees, just more green stuff, because that just encourages a sense of well-being as well. Increased efforts to early intervention through greater funding for mental health services. We want to make Bristol a zero suicide city. So we want a zero suicide framework. We want to work with universities and colleges to establish a student mental health charter to improve student mental health. And we want to develop a scheme to reward employers who invest in the mental well-being of their employees. So, and I think added to that, we haven't mentioned schools in there, but I think we also need to roll that out into schools as well. Because as you say, it's young people, it can start quite early on. The current education system, I think, is a nightmare for children's mental health. It's constant testing. If I were in government, I'd be, pushing to abolish GCSEs and pushing to abolish all of this testing that happens, because I think we're not educating our children, we're just teaching them to do tests and test after test after test, and it's killing people, it's killing the teachers, it's killing the students. So we have a real problem, and I'm not surprised that kids are leaving school with anxiety and depression, and I think we need to really take it very, very seriously. And I'd welcome other suggestions that the Listening Partnership have for things that we could implement.
We have actually had an emphasis on mental health since the very beginning of our administration. I come from a mental health background myself, working on the race equality mental health program, and actually commissioned some of the work out of Off the Record as well. So just to say, it is central to our approach now. With the City of Bristol College and educators, the city's finalising its educational recovery plan. Doesn't sound very friendly, but this is about how we support people to come off the back of the year of COVID. And in that educational recovery plan, mental health is a central plank of that, because we recognise the trauma people have been through over the last year. I think too is we know that good quality work is one of the single most effective interventions. People may need medical services, but it's the social determinants of health that are by far and away critical. So good quality work. Now, we've got out 12,000 experiences of work to young people, and we know 56% of young people were not getting access to meaningful work experience when we started. And work experience is essential to a pathway to work. And those work experiences are directed towards those people who don't normally get access to work experience, which will include a high proportion of disabled young people, but also young people with mental health challenges at the moment as well, who need that additional support. I'd say that in the wider city as well, there's again thinking about the wider determinants of health, delivering affordable homes, making sure people are fed, tackling cold homes, other forms of poverty, such as period poverty. These are all things impacting on young people. So the more we can tackle poor social conditions that people have to live with, as we are, as a city, the more we'll create the conditions in which mental health will be strengthened, so people are more resilient in the first instance, and where people are having to recover, they've got better conditions within which to recover.
How are you going to make sure that communications from central government are accessible for people with learning disabilities? Asked by Carl WECIL, peer advocate volunteer.
This is really important, because the decisions government makes, the benefits, the new legislation has a real impact on people's lives. But if they don't hear about it, don't understand it, can't interpret it, then obviously the information doesn't get through, and disabled people won't benefit. So I think the important thing here is to have as wide a set of trusted networks as possible. And I think this is where the council can support through its disability services and youth services and elsewhere to schools, because where there is a trusted relationship with a teacher, with a social worker, with a carer, then that information can be passed through to them, and that might be through a social media group, it might be a physical meeting, it might be through a Zoom call, it might be through even the mail, if that's the old snail mail. So the important thing is to maintain that network, so that when a new piece of government information comes down, then those networks already exist that not only just pass on the information but can interpret it, and that there's enough resource in the council system to really help people to interpret and understand it, and then act on it. And if that means applying for a new benefit or a change of benefits, that people have the support then to do that and act on whatever the new legislation or communication is.
All I can say to Carl would be, tell us what those difficulties are. Let's feed those into central government. Obviously, at the moment, we have a Conservative government. I have some connections there. I will do my best. If I don't know what those issues are. I'm sure there are some. I'm sure it's more difficult in some ways. So the accessibility, but yeah, I'm keen to see what influence we could have over that. But as you say, that's going to be central government policy and an issue there. But I will champion it.
It's a challenging question, because I literally don't have the power to make sure that central government do anything. It's a struggle getting any certainty out of central government. I can account for what we do. For example, on my Facebook Live, we have BSL interpreters on there now, and we have the translation services and subtitles on our broadcasts as well, to make them as accessible as possible. But we do continue to encourage government to adopt best practice and to be as accessible as possible. And again, our MPs are in a really good place to do that. I don't want to be defeatist, but yeah, working with national government is an interesting experience.
We haven't got that covered in our manifesto at all. I would say that I think that I would need to take guidance on exactly what format people would need it in, because I'm not a SEND specialist. I've got, I'm keen to make sure that we prioritise SEND provision, but I don't know much about it myself. And I think I would definitely need to take some advice really on what it is that people need in order to be able to understand those communications. They often come out as huge dossiers of things, and yes, we need to simplify them and have a simplified message. And to be honest, I don't think it's just learning difficulties. I think everyone struggles with a lot of the messages that comes from government, and I think it's it would be great if we actually had an office whose job it was to help people understand what our simple messages are. And I think, there's a few websites that occasionally are doing that and helping people understand, but then you have to be able to go to the website and read it. So it would be great if that sort of thing could actually be put out by the council, so that, there was somewhere that you could go to get information that was easy to understand, because yeah, there's an awful lot of stuff dressed up in fancy political jargon that I can't understand. So how are people with learning disabilities going to understand a lot of this stuff? So yeah, I'm all for making things clear and simple, and you can't have democracy if people can't access the information and can't understand the information. So you just need to phrase it differently, and I think it's very much the fault of the people giving out the information if it can't be understood by everybody. People need to work harder to make their messages clear and simple.
How will the Mayor ensure that accessibility is embedded into the many upcoming development projects? Temple Quarter in particular is a large, important piece of work, and accessibility should be at its centre. Bristol is a beautiful and important city and should be accessible to all visitors and residents. Asked by Phil, Bristol Physical Access Chain, EPAC.
So this goes back to what I was saying about the planning and having inclusivity at the core of planning. So yes, you need to say in that whole Temple Quarter development, if I'm in a wheelchair and I have to get my wheelchair out of the top box of my car and get into it and get around, or if I just have difficulties walking very far and I need a mobility scooter, are those things in place? And I would say what we have at the moment at the Capo Circus car park is quite good. You can park next to a mobility scooter hire, and then you can hire that and use that to get around. And I think we should have that in all of the kind of hubs of the city. And then ideally, you'd be able to use that scooter all day and go around all over the place, and that all these different parts of the city would be joined up. I think we need to think about people with sight loss. Pavement clutter is a nightmare, both for wheelchair users and people with difficulty walking and people with sight loss. So you need to think about what things are on the street, and obviously we want to get lots of trees in, but we need to make sure that we plan things in such a way that it's clear where the walkway is. Yes, I think it just comes into careful planning and consultation the whole way through the planning process, so that because if you don't consult, you're going to miss something. I think that's the thing, because nobody thinks of everything. So it's really key to actually run the plans past groups and say, oh, you know, are we covering all of our bases?
Thanks, Phil. So there's a number of ways. One is I will insist, and obviously I'm in those conversations with our regeneration team. We have a fantastic executive director of growth and regeneration now. It's Stephen Peacock. And we just make sure, as he knows, that we're a city that wants to be inclusive, and making sure that our major regeneration projects, and you're right, there are huge, Temple Meads, Temple Island, Temple Quarter behind Temple Meads, Western Harbour being, you know, big one. All these, there's billions of pounds worth of regeneration need to be physically, you know, accessible to people, and so we'll make sure. But again, I'll come back to the point about leadership as well from disabled people. You know, we're setting up the Mayor's Commission for disabled people, just like we've had the Women's Commission and the BME Commission, and therein that would be your leadership able to shape the city plan, one city approach, and city policy, and set those expectations, not just for what the council does, but for what other institutions in the city do as well. So your leadership and your voice and the visibility and power of that voice within that city office approach would be really significant. I might just add to that, again, with that commission, what we really want to happen is to take the one city plan and make sure there is a specific strategy for disabled people to make this an accessible city that runs through that one city plan. There are a number of strands to it. Remember, transport, health, homes, economic development, environment. The opportunity with the commission is to grab a hold. Well, you have that opportunity now, but the opportunity is to grab a hold of all of those themes, have conversations with all of those thematic boards, and make sure they understand what access means for each of their areas of work. Children is the other new board. So you know, I'll press, but I'll press with you as a fellow leader in making that happen.
My understanding is it's by law you have to have this. But then, of course, you know, maybe what's required by law isn't good enough for you know, what we would aspire to. I would certainly want to make sure that all projects and developments, I mean, this comes through our planning process. You know, if Phil has a particular issue, again, I think I need to be, you know, if I'm mayor, come and talk to me. We'll talk to planning. We'll see what's going wrong, if anything has gone wrong in those areas, because, you know, big developments like that should be accessible to everybody in all ways, whether it's the leisure aspect of it, the work and job aspect, the residential aspect of it. You know, I'd be very keen to see if we are falling short in the planning process, that and we're not doing as well as we could.
Thanks for the question, Phil. It's a really good one and a really important one. Our city should be accessible to all, and this is something I have some experience of. I've taken over old buildings, the old fire station in the middle of the city centre, turned it into a youth hub. We run a number of youth centres around the city and have done them up. So we've done that kind of physical change of development, and wanted to make, you know, what in some cases are old listed buildings accessible for everybody. And so the most important thing is, and I've mentioned this in a previous question, is to listen to disabled people. It's really, really important. So at the station, we had young autistic people, young people in wheelchairs, young people with visual impairments, deaf young people, and a whole range of others, working with the architects to make sure the colours were right, the fire alarm was right, that the signage was accessible, that routes around the building were accessible. They looked at toilet design, the doors, and a whole range of other things, and therefore it is a welcoming and accessible building, despite the challenges of it being a 1930s building, which was, there are some things that the listing people and heritage people say you can't change. So we had to really sort of work through some of those difficulties. But by taking the time to do that in places like Temple Quarter, in the city centre, in how we design our communities and open spaces, how we design our pavements, that they're wide enough for people to walk or ride down sort of side by side, so that you can walk with your dog or your children or your friend down the road, is really, really important. So again, that means listening to disabled people and disabled people's groups, but also then making sure those groups have the funding to be able to do it. Very often organisations and individuals are asked to consult on this and help with the design of that, but for free, out of the goodness of the heart. Well, the architects and designers are paid to do their work. Why shouldn't those who are disabled and have that sort of expertise should also be paid to do that? And I think that's a really important point in terms of how we fund disabled groups and equalities groups more generally.
Thank you to our VIP citizen members and the communities we work with for your involvement and questions, and to the candidates for taking part.